Hello everyone, welcome to Scalp Acupuncture, featuring locations and indications of areas. Precise location of Chinese scalp acupuncture areas requires identification of two imaginary lines on the head. The anterior-posterior line runs along the center line of the head. The midpoint of this line on the skull is located halfway between the occipital protuberance and the glabella, which is midway between the eyebrows. The second line, the horizontal line, runs along the sides of the head from the highest point of the eyebrow to the occipital protuberance. Where this line intersects the anterior hairline at the temple, defines the lower point of the motor area. In patients without a definite hairline, an alternative method for locating this point is to draw a vertical line up from acupuncture point stomach 7 until it intersects the horizontal line. The motor area is located on the area of the scalp corresponding to the precentral gyrus of the frontal lobe. The motor area is located in a strip beginning at the midline at a point 0.5 centimeter posterior to the previously located midpoint of the head, along the anterior-posterior line. The motor area runs from this point obliquely down to the point where the eyebrow-occipital line intersects the anterior hairline. The line of the motor area determines the angle and location of several other areas, such as the sensory area and chorea and tremor area. The motor area of the cerebral cortex controls and adjusts intersectional body movements. One side of the cerebral cortex controls the contralateral muscles of the body below the neck. In contrast, most head and face muscles are controlled bilaterally. The size of the motor gyrus of the cerebral cortex is associated with complexity and accuracy of body movement. A larger representative area equates to greater complexity and accuracy. The motor gyrus is depicted as a reversed homunculus. For example, the upper part of the gyrus controls the lower limbs, while the middle part of the gyrus controls the upper limbs, and the lower parts control head and face movement. The motor area is divided into 3 regions according to the homunculus projection. In order to correctly locate these 3 regions, the whole motor area is divided equally into fifths. Then 3 regions are measured as follows: upper 1/5 region, middle 2/5 region, and lower 2/5 region. The upper 1/5 region is used to treat contralateral dysfunctional movement of the lower extremity, trunk, spinal cord, and neck. The middle 2/5 region is used to treat contralateral dysfunctional movement of the upper extremity. The lower 2/5 region is used to treat bilateral dysfunctional movement of the face and head. It is also an effective area for treating dysphagia due to stroke and other brain damage. These areas are used to affect the contralateral side of the body. The direction of needling is usually from the upper part of the area downward, penetrating the entire area. Motor area indications. Indications for the application of needles in the motor area are paralysis or weakness in the face, trunk, or limbs caused by stroke, multiple sclerosis, traumatic paraplegia, acute myelitis, progressive myotrophy, neuritis, poliomyelitis, post-polio syndrome, periodic paralysis, hysterical paralysis, Bell's palsy, spinal cord injury, traumatic brain injury, Charcot-Marie tooth disease, and brain damage from brain surgery. Among the disorders mentioned above, the most common problems are generally paralysis due to stroke, multiple sclerosis, and traumatic injury. When treating stroke from thrombosis and embolism, scalp acupuncture treatment should begin as soon as possible. When treating a hemorrhagic stroke, scalp acupuncture treatment should not be performed until the patient's condition is stable, typically at least 1 month after the stroke. Though stroke can be treated at any stage, the greatest response to treatment will be for strokes occurring less than a year prior to scalp acupuncture. The longer the duration of the impairment, the more gradual the improvement will be. With long-term cases of impairment, expectations need to be realistic, although some patients will occasionally surprise practitioners. Improvement is rare for patients with a long history of paralysis that has led to muscular atrophy, rigid joints, and inflexibility. When treating chronic progressive diseases like multiple sclerosis and Parkinson's disease, the results from treatment are often temporary. Results may last for hours, days, weeks, or months, but ongoing follow-up treatments will be necessary. However, when treating paralysis from either stroke or trauma, improvements of movement are often permanent. Each part of the cerebral cortex has its own functions, according to our current understanding of the brain. When one area is impaired, the impaired area can recover to a limited extent. In addition, by employing proper stimulation, other areas can compensate for the impaired area. This may be the answer to explaining the mechanism of scalp acupuncture in treating impairment in the cerebral cortex. Generally speaking, paralyzed extremities are targeted by treating the opposite side of the motor area in the scalp. For instance, if a patient has paralysis of the right leg and foot, needles should be inserted into the patient's left motor area of the scalp. However, for patients undergoing brain surgery or with an injury where part of the brain or the scalp has been removed, needling should be on the same side of the scalp as the side of the paralyzed limb. The sensory area is located on the projective area of the scalp, corresponding to the post-central gyrus of the parietal lobe. The sensory area is one of the most commonly used in Chinese scalp acupuncture. It is located parallel to and 1.5 centimeters posterior to the motor area. The sensory area of the cerebral cortex controls and adjusts sensations on the opposite side of the body. One side of the cerebral cortex controls contralateral sensations of the body in the level below the neck. In contrast, most of the sensations of the head and face are bilateral. The sensory gyrus, like the motor gyrus, is also distributed as an upside-down homunculus. That means the upper part of the gyrus controls the lower limbs, the middle part dominates the upper limbs, and the lower part controls head and facial sensations. The sensory area is also divided into 3 regions according to the inverted homunculus projection and with the same proportions as discussed for the motor area: the upper 1/5, the middle 2/5, and the lower 2/5. These areas are used to affect the contralateral side of the body. The direction of needling is usually from the upper part of the area downward, penetrating the entire area. Indications for the application of scalp acupuncture to the sensory area include abnormal sensations of face, trunk, and limbs that are either hyposensitive or hypersensitive, including pain, tingling, numbness, and loss of sensation in the contralateral side of the body. Disorders that have shown positive results when treated by scalp acupuncture include loss of sensation or pain from stroke and traumatic injury, numbness and tingling from multiple sclerosis, phantom pain, complex regional pain, residual limb pain, trigeminal neuralgia, temporomandibular joint or TMJ pain, migraine headache, cluster headache, shingles, pain in the neck, shoulder, back, and lower back, sciatica, gout, plantar fasciitis, fibromyalgia, neuropathy, and paresthesia. In general, abnormal sensations of an extremity are treated by choosing the opposite side of the sensory area in the scalp. For instance, if a patient has pain in the right leg and foot, the left side of the sensory area in the scalp should be needled. However, for patients having had brain surgery or an injury where part of brain or scalp was removed, needles should be placed on the same side of the scalp as the affected limb. For example, a patient with numbness in the left leg and foot would be treated with needles on the left side of the scalp's sensory area. Scalp acupuncture produces excellent results for pain, numbness, and tingling. Many patients show significant improvement during the initial treatment. Scalp acupuncture results in much quicker effects compared to other types of acupuncture, such as in the ear, hand, or body. Some patients feel improvement just a few seconds or a few minutes after the needles are inserted. As with the motor area, the upper 1/5 of the sensory area is used to treat abnormal sensation and pain in the lower extremities: trunk, back, chest, and neck. The middle 2/5 is used for upper extremities. The lower 2/5 is used for problems with the face and head, including migraines, headaches, trigeminal neuralgia, toothache, and temporomandibular joint or TMJ pain. The chorea and tremor area is located on the projective area of the scalp, corresponding to the premotor cortex. This gyrus has important functions in adjusting the stability of voluntary movement and the control of muscular tension. The chorea and tremor area is located parallel to and 1.5 centimeters anterior to the motor area, running 4 centimeters down in the same direction. It starts 1 centimeter anterior to the midpoint at its upper point. This area is always needled bilaterally and is used for any involuntary motor activity. This is the primary area for the treatment of Parkinson's disease, any type of tremor, shaking of the head, body or extremities, chorea, tic, restless leg syndrome, and dystonia. This area is also very effective for treating patients with muscular tension and tightness in any part of the body. The direction of needling is usually from the upper part of the area downward, penetrating the entire area. Vascular dilation and constriction area. This area is parallel to and 1.5 centimeters anterior to the chorea and tremor area, or 3 centimeters anterior to the motor area. This area is always needled bilaterally and can be used for essential hypertension, cortical edema, and other autonomic vascular dysfunctions. The direction of needling is usually from the upper part of the area downward, penetrating the entire area. Vertigo and hearing area. This area is located over the temporal lobe on the lateral side of the head. It is on a horizontal line, 4 centimeters long. It starts 1.5 centimeters superior to the apex of the auricle of the ear at its middle point, and extends 2 centimeters anterior and 2 centimeters posterior to the middle point. This area is also needled bilaterally and can be needled in either direction. This is a very useful area for treating vertigo, dizziness, Meniere's disease, tinnitus, hearing loss, and auditory hallucinations. There are 3 speech areas. Speech 1 area is located on the posterior third of the gyrus frontalis inferior over the frontal lobe and controls groups of muscles for speech and phonation. This area corresponds to Broca's area of the frontal lobe, which controls the muscles of the tongue and mouth that form speech. Speech 1 area overlaps the lower 2/5 of the motor area. The indications for speech 1 area are dysarthria, dysphonia, or motor aphasia after a stroke or brain injury, due to which the muscles of speech and vocalization have been paralyzed. This area is needled bilaterally for motor aphasia. The direction of needling is usually from the upper part of the area downward, penetrating the entire area. Speech 2 area lies over the reading and comprehension part of the parietal lobe and is located by finding the parietal tubercle. From the parietal tubercle ran a line parallel to the anterior-posterior line 2 centimeters posteriorly. Using this as the starting point, the speech 2 area runs 3 centimeters in length, parallel to the anterior-posterior line. This area is needled bilaterally for nominal aphasia, the inability to name objects. In this disorder, the patient can describe an object but cannot produce the noun. The direction of needling is usually from the upper part of the area downward, penetrating the entire length. Speech 3 area overlies Wernicke's area of the temporal lobe and overlaps the posterior half of the vertigo and hearing area. It lies on the same horizontal line, 1.5 centimeters superior to the apex of the auricle, but begins at the midpoint of the vertigo and hearing area, directly above the auricle, and runs 4 centimeters posteriorly. It is used bilaterally for treatment of receptive aphasia, where the patient can articulate words, but the words don't make sense. The direction of needling can go either from posterior to anterior or from anterior to posterior, penetrating the entire area. Praxis area is an uncommonly used area. Starting from the parietal tubercle, the praxis area joins 3 lines, one running straight downward and the other 2 at a 40-degree angle anterior and posterior to the vertical line. This area is used for apraxia, the inability to execute certain fine motor activities such as buttoning a shirt. The vision area is located over the occipital lobe on the posterior aspect of the head. It starts on a horizontal line at the level of the occipital protuberance. The vision area starts at a point 1 centimeter lateral to the occipital protuberance and runs upward for 4 centimeters, parallel to the anterior-posterior line. The vision area is often needled bilaterally, unlike other scalp areas in Chinese acupuncture into which needling could be any direction. The vision area must be needled from the top down. Needling from below pointing upward risks injury to the medulla if the needling angle or depth is wrong. Indications for needling are vision loss due to stroke or brain injury, visual field loss, double vision, visual hallucination, and nystagmus. The balance area is located over the cerebellum. It starts on a horizontal line at the level of the occipital protuberance. The balance area starts from a point 3.5 centimeters lateral to the occipital protuberance and runs 4 centimeters inferiorly. The balance area is needled bilaterally. Like the vision area, it must be needled from the top down. Needling from below pointing upward risks injury to the medulla. Indications for needling the balance area are disequilibrium, cerebellar atrophy, cerebellar strokes, multiple sclerosis, Parkinson's disease, ataxia, and loss of balance due to traumatic brain injury. The foot, motor, and sensory area is the most commonly used one in Chinese scalp acupuncture. It has broad-ranging effects on both motor and sensory functions. The FMSA is located parallel to the anterior-posterior line and running 4 centimeters posteriorly. The foot, motor, and sensory area gets its name from including both the motor area and the sensory area in the region of the foot on the homunculus. While it is useful for motor and sensory problems of the feet, the foot, motor, and sensory area has a much broader effect and is used for a wide range of symptoms. Since the area overlies many endocrine glands, such as the pituitary gland and adrenal glands, it not only affects the central nervous system, but also regulates the endocrine system. That is why this area can treat many different kinds of disorders. The foot, motor, and sensory area is usually needled bilaterally, either from the front part of the area toward the back part or vice versa. However, it is relatively easier if the direction is from front to back. Indications for needling FMSA: paralysis of the leg or foot, restless leg syndrome, pain in the legs and feet, including gout, peripheral neuropathy, plantar fasciitis, reflex sympathetic dystrophy or complex regional pain, fibromyalgia, phantom pain, residual limb pain, numbness and tingling in legs and feet, pain in the neck and shoulders, incontinence of urine, bedwetting, incontinence of stool, irritable bowel syndrome, impotence, premature ejaculation, decreased libido, infertility, prolapse of the uterus, prolapse of the bladder, amenorrhea, dysmenorrhea, abnormal uterine bleeding, psoriasis, neurodermatitis, shingles, ADHD, post-traumatic stress disorder, post-concussion syndrome, poor memory, poor concentration, emotional disturbances, mental retardation. Avoid needling the foot, motor, and sensory area in pregnancy, as there is a theoretical risk of inducing uterine contractions. The internal organ areas are located on the front of the head. The location of these areas is based on clinical experience rather than anatomy and physiology as known in Western medicine. These scalp areas are not used very often since traditional body acupuncture produces excellent results. The head area is located on the midline of the forehead, running from the hairline 2 centimeters superiorly and inferiorly. The area is used for treating mental and emotional disorders such as insomnia, poor memory, poor concentration, anxiety, and depression. Stomach area is located on the mid-pupillary line from the hairline 2 centimeters superiorly. This area is used for treating stomach pain and discomfort in the upper epigastric region. Thoracic cavity area is located half the distance between the stomach area and the midline, running from the hairline 2 centimeters superiorly and inferiorly. This area is used for treating asthma and tachycardia. Liver and gallbladder area or line descends onto the forehead for 2 centimeters along the mid-pupillary line. This area is used for treating costal pain and rib pain due to hepatitis, gallstones, and shingles. Reproductive area starts at the frontal corner of the hairline, running 2 centimeters superiorly. It is useful for treating menstrual cramps, bleeding, and urinary tract infection. The large intestine area descends onto the forehead for 2 centimeters along the reproductive area. The area can be used in cases of diarrhea, or constipation. Thank you very much for your attention and hope to see you in our next videos.